Hey guys, so I am back again. So something that I remember being terrified of when I was first starting rotations was how to deal with a difficult patient. Some of these things and ideas you may have heard of or may be familiar with if you ever worked in any type of customer service industry. And honestly, a lot of these things I actually got from a previous job I had. And I remember I had an old boss that told me there are two things that people are extremely sensitive and emotional about. First thing is their health. Second thing is their money. And both of these things are true. They're both very sensitive situations, and they're things that can change someone's whole entire life. Obviously, health is much more important than the latter, but a lot of these same things can be applied, and I've used them on my clinical rotation, and it has made a huge difference. So first thing I want to remind you guys of, if you walk into a patient room and they are just angry and upset, it's not about you. They have so many other things going on. They're in the hospital, most likely if you're on your rotation. So they could be frustrated, they could be scared, they could be feeling out of control. And a lot of times those emotions get misplaced onto whoever has walked into the room. And whether it's that they are frustrated with their general situation or something has occurred to create this anger, there are different things that you can do to kind of handle it appropriately when you are the one that is on the receiving end of those emotions. So first thing that I suggest is you need to try to stay calm. And of course, this can be hard in any situation when someone is being either, speaking to you in an aggressive manner or perhaps not being that polite, maybe a little bit insulting. You need to stay calm. You need to try to stay confident, because the more confident you are as well, it's going to be more believable whatever you are saying. You have spent so much time in school and you've learned so many things. Put that knowledge to use. Something else, on top of staying calm and confident, you need to try to be mindful of your own personal body language and your facial expressions. If you come into a patient's room and they are frustrated and you're just sitting there with your arms crossed, kind of leaned back and giving them a look, it's not going to help. Whether what they're saying is insulting to you personally or they're coming across aggressive, as hard as it may be to keep your body language in mind or the way you're breathing, because if you're sitting there when they're talking, even if it's quiet, they're going to catch that because they are hyper focused on you at this point because you are the one that is in the room. So you need to keep your overall body language and your reactions in mind, because in the long run, this is going to make the situation easier for you to deal with, and it's going to let the patient know that you are really listening to them and you are taking what they're saying into account. So like I said, when you walk into the room, it's not necessarily always something that anyone has done. More often than not, the patient is frustrated and they're feeling out of control and they want to feel in control about something, or if something has occurred, we need to be a patient advocate and we need to really listen. So when the patient is telling you why they're frustrated, don't just sit there and go, oh, okay, oh, okay. One of the biggest things you can do is acknowledge the way they're feeling. If they're telling you, I don't know, maybe their bed wasn't made, or perhaps their medication didn't come on time, or they've been trying to get a hold of their nurse, you can really look at them and, not too intensely, but make sure that they realize that you are focusing on them and letting them know, hey, I apologize that happened. What can I do for you right now to make this better? And if it's something that you can do, let's say they're upset because they're cold, turn the thermostat up, go find a blanket. If it's something that you can personally do, do it. Don't go, ask the nurse or the CNA to stop whatever they're doing to get something that you can physically do, because one, the patient's going to appreciate it, that you are listening to them and taking into account whatever it is that is bothering them at that moment, and you are taking care of it. Also, if you say you're going to do something, do it immediately, because I don't think anyone ever intentionally tells a patient, oh yes, I'm going to do this for you, and then they don't. It's just so easy to get pulled away when you're in clinical rotations or going to the next patient's room that, or something happens that perhaps it slips your mind, and the patient will remember that. So if you make a commitment and tell that patient you are going to do something for them, whether it be getting something that you are allowed to get or, you know, letting the nurse know that they are looking for you, check back in with that patient and let them know you have done what they asked you to. So if it is something like they need pain medication, let the nurse know. Go back to the patient room and say, hey, I let your nurse know. Use the nurse's name, you know, let them know that you actually know who their nurse is. And then say, they'll be in as soon as possible, you know, they're finishing up care for another patient, but they are aware that you are looking for them. So the biggest thing is just acknowledging what the patient is upset about and remedying whatever you can. Because like I said, a lot of times it's more the frustration of their situation or feeling out of control with so many other things happening around them. And in the hospital, there are so many things happening with each worker that sometimes people just, you know, zip in and out of a room. And although we do generally listen to our patients, I could see how it would be easy for a patient to perhaps feel that maybe they are not getting the attention that they feel they deserve. Because a patient cannot see what's going on outside of their room. So even if you have 3 floors of treatments and, you know, codes happening and transports, the patient doesn't know that, obviously. And it's not very appropriate of us to tell the patient, look, I've got a lot of patients and I can't do this right now. Because to them, that's not what matters. They're concerned with their health, of course. Who wouldn't it be? So we need to do whatever we can in our power to let them know we're listening. More often than not, that's going to be the biggest resolution to many of your problems, is just letting your patient know that you are listening, you're aware of their concern, and you're going to do whatever you can to resolve those things. If it's ever something, obviously, that the patient feels is being, you know, done incorrectly, or if for some reason the patient is aggressive with you in a physical manner or inappropriate, in those situations, it's definitely okay to get somebody else involved, whether it be a supervisor, obviously, or if you have, you know, your preceptor, let them know, hey, this is what's going on with this patient. I'm uncomfortable going in this room for reasons A, B, and C, or, you know, make sure that if you do feel like you are in danger of any sort, to escalate that, because you shouldn't feel scared to go into a room thinking that someone's going to do something, and you shouldn't feel like you have to put yourself in danger if someone is being aggressive with you. So if that happens, again, make sure you escalate that and let people know what's going on, and they will take the appropriate routes to make sure that you are safe, of course. Primarily what I was just talking about is an upset patient, someone that is upset about everything that's going on, or having a really rough couple of days, months, whatever, depending on their diagnosis and things that they've been going through. So this does not generally apply also to a patient perhaps that is confused, because sometimes there is, you know, you can listen to the patient, obviously, but if they're confused and agitated, there are other things that can be done in that situation for the patient. But make sure that you are doing, you know, really listening to what their concerns are and doing whatever you can to fix them. So that's pretty much it for this. If you guys have any tips of how you deal with, you know, frustrated patients, definitely leave them in the comments down below so that all of our people watching today can also learn from some of those tips. Those are just some of my primary things that I like to do. Of course, each situation is going to be different, and unfortunately there may be situations where you are not able to please the person. But again, we have to be patient advocates and do everything within our power to try to resolve whatever is going on with the patient. But again, make sure you guys follow me on Instagram. It's just breatheeasy_SRT, and leave any comments you might have below for me, and I will talk to you guys next time.